without concern, can you be commissioned? No, first you should have what? The concern inside, then after that you can be commissioned. Or let me think for her, let me do something for her, let me do something for her. Like that. Okay? Okay, that means your job. So that means trying to keep patients what so that the patients feel what comfortable, okay, and good. Trying to stabilize emotionally, physically, in everything. That is your job. Yes, you have to make them comfortable. Really, that's very important. I mean, yeah. we may think it is not like that much, but really it has a big. Okay, sometimes some patients when they go to for examinations, they might feel like good, they might feel better, because if the environment is conducive. Okay, when they come out of their environment, okay, then when they go like that kind of environment, then all their stuff is okay. Even their blood pressure is okay, they will be okay. Yeah? Yeah? Yeah. So that means that is one part of our job, to make patients feel what? Comfortable. Okay? And any thing that procedure that you are doing, okay, what should you do? You have to explain to the patients. Okay, I'm not sure in the vet clinics. Anyone who works in the vet clinic, animal clinic, do they explain for the patient, for the dog, the procedure? Hey, doggy, I'm going to inject you on this and this. Yeah, actually, I think you have to talk. Yes. You have to communicate. Yeah? I remember when we were in residency, I had my anesthesia department, and we have to attend there for 2 months or something like that. So we have to work there in anesthesia. So usually patients with coma and so on will come. That means they don't respond, but they are in coma. Okay, and there was a Germany, her name Bumaster, she was from Germany, and then she's the emergency doctor. And then she trained us like that. That means even if she's there, you have to talk to them. Yeah?
Because sometimes in coma, the patient or the person knows everything, but they
not response, because
the
hearing sense is the last sense is the hearing.
So you see, she always, when she is doing procedure, she talks with the patient.
The patient
so she so you have to communicate, even if the patient is not responding. You have to tell them what you are doing and what. Okay, you have to tell them, because still they are alive, and they can they can at least they listen, or they hear what you are saying.
But they not respond.
Yeah. Okay. So I think in any life there is communication. Let's say plants, they communicate. Cells, they communicate.
Of course.
Yeah. Cells, for example, when they exchange some chemicals, they are communicating.
Communication.
Yeah. When chemicals pass from one cell to the outside, from outside to inside, we call intracellular, extracellular. There are some chemicals. They have receptors and so on. They are communicating.
Yeah.
So that means at their level there is what? There is communication. So all life forms in one or another, okay, they communicate. Yeah, they communicate. So that means, but we have to communicate under their level, okay? Okay. Okay. Okay, let's go to caring for, any questions here? Caring for bedridden or bed-stricken patients. So what do you mean by bedridden or bed-stricken? That means patients who stay in bed for a long time.
Yes.
Okay. So that means you have to keep those patients more comfortable by doing like many things. So, okay. So which things should you do? Like it can be general. I think those of you who work as CNA, Maybe you have experience on this. I mean, maybe you teach us. We don't teach you this one. Yeah, especially patients who are on bed. Okay, let's say they can't walk, they can't come out. Okay, or they are paralyzed.
Position change.
Oh yeah, or they have a bed sore,
Bed sore
and so on. Or to avoid a bed sore, what do you do?
Every 4 hours, the
Yes.
side position change to the
Yeah.
patient.
Yeah,
And if the patient is walking, so you
Yeah.
walk them the patients.
I think she can teach us
Yeah.
this topic.
Yeah.
No, because I'm learning.
you already
seeing
you've been passing it
I
there.
haven't seen it, that's the reason.
So she passed the exam the first time.
Yeah, I passed first time.
Yeah, okay. Okay, so we classified this one into two, into general and specific. Okay, so what do you mean by general? General means you have to support, as Nafisa mentioned, you have to support what? Their back, their joints, in order to prevent what? A strain. Okay, what do you mean by strain?
Do this, do that.
So we have two things here. We have a strain, and that means especially on the ligaments, conditions of ligaments. Here, you see, a strain.
Muscles.
So, strain you can have grade 1, grade 2, and grade 3. So, strain means a tension on the muscles. Okay? Look, here there is some cut, you see, because of that tension. There is some cut. But look, the cut is different. This one is just the muscles are what? Stretched,
Stress.
but it's not cut. Here, when there is a partial cut, it's grade 2. When it's a total tear, a total cut, is grade what? 3.
Grade 3.
Okay, that is what we call a strain. The other is what we call a sprain. The other term is sprain. Can you see? Sprain. So what is the difference between strain versus sprain? What's the difference between these two? So a joint strain is the overstretching or tearing of muscles or tendons. When it's a strain, strain means you put the muscle or tendon into tension. You can remember it with T. Can you see T? Tension. Okay, you put tension on the muscle or tendon. So sprain is usually a tension on the joints, especially the ligaments. You know, there are ligaments on the joints. Yes? Ligaments are what? Structures that support the joint. Okay, got it? Okay, let's see here. Let's see here. Okay, let's see this picture here. Can you see here? Okay. Okay. If you see here, you have, for example, which joint is this?
Knee? Is it
No,
knee?
no.
Oh.
This is what? Elbow.
Elbow, yeah.
Yeah, here. Okay.
Okay. Okay. This one is elbow. So if you see the elbow here, you have some ligaments here. Can you see? These ligaments here, they support the joint.
Joints.
Okay. This muscle and tendon, they move the joint. Okay. Okay. So this is the biceps tendon. Yeah, biceps. That's here.
Yeah.
Okay. This is the bicipital tendon with aponeurosis. It's attached here. So when there is a tear on this, it's called strain. So you put tension on the muscle, T, tension. And sprain when you damage the ligaments. Got it? That's what we call a strain and sprain. Strain and strain versus sprain. Okay. So here, strain, sprain. So usually this one is to muscles and tendons. Sprain is to joints and ligaments. Okay. Also the same, sprain has also a degree. It can be like mild, moderate, severe, or like the strain, grade 1, grade 2, grade 3. When there is only like tension, is grade 1. When there is a partial cut, grade 2. Total cut, grade 3. Okay. How do you treat that if you have a sprain? If someone comes with ankle sprain, or I have pain here on my ankle here, okay. Then, let's say, what do you do for that?
Exercise, range of motion.
Okay, you what? The treatment or?
It's not treatment, it's like the exercise.
Okay.
We give the range of motion or give the support for the pillows.
Yeah. Okay, that's good. But the patients have what? Pain, don't forget that.
Yeah.
So if they have pain, okay, first you need to give the degree or the grade of the sprain. What grade is that? Then the second thing is you have to immobilize. Okay? What do you mean by immobilization? Immobilize. Do not move. So that to avoid what? Pain.
Pain.
Okay? That's what you give. Let's say when you put like elastic bandage.
Elastic.
You saw here on the
Stockings
picture, yes? In the
or-
picture here?
Yeah.
Okay, somewhere they put that one. Somewhere I saw the ankle putting elastic band. Why? So that is to stop the pain. That's what you do. But if the degree is severe, like maybe 2 or like 3, then you should do what? Surgical repair.
Yeah, but it's all for the doctor's order. If the
Yeah.
doctors give the
Yeah,
order,
yeah.
so we put the elastic
Yes.
embellence in stockings or
Yeah,
elastic
it depends on what the doctor ordering after. Yes. Let's say, for example, the Achilles tendon rupture. Do you know Achilles tendon? This is the Achilles tendon. You know on your back here.
Yeah.
This is the Achilles tendon, yes? Okay, it might rupture. Can you see? Look, it's right. That means it's totally separated apart. Yes. So in this case, it should be what? Repaired with surgery.
Yeah, surgery.
Even the surgery, you can't repair it like, but there is what we call a Z-plasty technique. Like with Z-plasty, what you do will be, you cut this tendon into half, okay, into half, and you cut also this one into half, and then you slide one into the other like this. So the two, this is called tendon elongation. You elongate the tendon. It's called tendon lengthening. Let me show you tendon lengthening. Tendon lengthening in Achilles. You see? You actually cut it here, okay, and then you look. They do the tendon lengthening. Can you see? You cut from this part. You cut half of it from that half, so that you see you have a lengthening
Okay.
like this. So that you have. Otherwise, it will be short.
Yeah.
Okay, and let's say then after that, what do you need to do? You have to put it in a cast.
Yeah,
So that's okay. Okay. So how do you make the position of the ankle? How do you put? You see the position of the ankle? You have to put it in like this. You have to put it like this. Why? Because this area will relax and then the healing will be good. Otherwise, if you put it like this, there will be tension and it might break. Again. Okay? So this is called the tender Langley procedures. This is being done for many things. So one thing for bedridden is that means you have to avoid strain and stress on the muscles and joints. So you have to move the patients. So arms and legs should be what? In a comfortable position and if it is supported, okay? During bed changes, communication with the patient is important to gain cooperation. And movement should be guided rather than lifting patients. And some other things are what? Give them what? Pillow?
Support.
Yes. And give them what? Bed cradle. What's bed cradle?
Safety or not like the
Yeah,
position.
like this. Okay, these are called bed cradles. Okay, to keep weight of upper beds of patients. And air rings. Put air rings under buttocks if signs of pressure source at the base of the spine show. Do you know air rings? Not earrings, air rings. Okay, like this. So sometimes you can use some kind of seat for when you have especially fracture of the coccygeal bone. You know the coccyx? You know the spine vertebrae. How many spine vertebrae do we have?
17.
Yeah. What are they?
Spinal cord?
No. How many the vertebral bones? I think he took it then.
29.
Oh, okay. We have 5 major kinds. Yes.
Yeah.
We have the cervical bone, are 7. Okay, spinal vertebrae. Cervical are what? 7. Thoracic are what? 12. Then lumbar are what? 5. Then sacral are what? 5. And coccygeal or coccyx 3 to 5. Okay, so total you have what? You have, what is this? 19, 24 and 5, 29 and 3, 32 to 34. So you have 32 to 34 spinal bones. So these are the coccyx or coccygeal. Coccyx, they are called coccyx. So usually there can be fracture of the coccygeal bone. And really, if they are fractured, then you will have severe pain here. Can you see? Around here. You will have, look here, break. Can you see? Broken here. So you will have a very serious pain on that. So usually it's difficult for them to see it like this, like you. Oh, you see? Sometimes you see we have to thank whatever that we are sitting is good. Yeah. And that's why they have to carry what? Their seats with them. They can't drive car. Long like distance. They will have serious pain. So they have to always carry that in their car, outside, wherever they sit. Okay? That is you look here. This can be, look, can you see here?
Yeah.
That beauty break, can you see there is a break? So there is, look, all over here is pain.
How we can pronounce it? Coccyx?
Coccyx. Go to my special YouTube and pronounce it.
Coccyx. Coccyx.
Okay, so they are used usually there.
In this video, I'd like to teach you the importance of connecting words.
Thank you. Okay, any questions? Okay, then next let's go to pharmacology. Pharmacology or medication. So, why do we study medications like separate or alone? Why do we study that?
We should know how to apply or how to give medicine to a
The
patient.
patient. Yes, we should know. And why should you know? Because medications are what? Both useful and also important, and they are also what? Harmful. They have also adverse effects. They have also side effects.
Yes.
Yes?
We have to know.
Yeah. So okay, that's why we need to know that. They are useful, and at the same time they have also what we call an adverse effect. Okay? So when we study drugs usually we study what we call pharmacodynamics, which is called PD, pharmacodynamics. And we have pharmacokinetics, which is called okay. So we study the pharmacodynamics of the drug, and we study the pharmacokinetics. So what do you mean by pharmacodynamics? Pharmacodynamics means we can give a definition. What the drug is doing to the body is studied under drug to the body. What the drug is doing to the body, you take the drug, yes? Then you are doing something, the drug is doing something on the body, yes? That is studied under pharmacodynamics. But what the body is doing, in return, what the body is doing on the drug is studied under pharmacokinetics. So, usually we classify this pharmacokinetics into 4. Usually the drug will be what? First absorption. Distribution. Metabolism. And excretion.